a question that I get asked repeatedly that I haven't taken the time to address in a long time came up on a webinar that I was doing today for orthopedic executives and coders. And that question was, what happens when you see a patient in your practice and then later find out that they were residents at a SNF? Hi, Shannon DeConda here with NAMAS, a division of Doctors Management. So what happens? You get that telephone call or you get a bill back from the SNF who says, hey, this patient was actually based in a SNF when you saw the patient, and therefore certain parts of your services won't be reimbursed by Medicare Part B. And you're stuck holding the bag on the technical component of actually the X-ray services. Well, I'm going to give you a link where you can actually go and actually show the SNF where they're responsible for reimbursing your practice for the technical component of those services. So look with me at the link and you're going to see that actually what happened was way back in 1997, there was a Balanced Budget Act that we're all very familiar with that created the Consolidated Billing Act. Under the Consolidated Billing Act way back then, that created that SNFs would bill under this plan that pretty much made them bill like inpatient services, like happens when we go in the hospital, so that the SNF would present one bill for the residents while they were under the SNF stay. So once they submit that one bill for the patient stay under the Consolidated Billing Act, those services would go in and then be billed, except for services that aren't covered like any other stay or any other service for a patient. Now, there are a number of other services that just aren't covered under that SNF covered benefits or the consolidated billing services. And those services could be separately billed to Medicare Part B services. And part of those services are services that are provided by a physician who's covered under Part B services. Now, under that, part of it in this link that I'm going to provide you says specifically, and I'm going to read to you, many physician services include both professional and technical components, and the technical component is subject to consolidated billing. The technical component of physician services must be billed to and reimbursed by the SNF. So you can take this link, print this off, send it to the skilled nursing facility and say, excuse me, per CMS guidelines, it is your responsibility to reimburse us for the service that we rendered to your resident that you've been reimbursed for through consolidated billing. And you should have an agreement with the different SNFs that you service and let them know ahead of time. We're always happy to see your patients. However, if we're going to help service your patients, you need to know we expect prompt payment for the services that are rendered for your skilled nursing patients that we see. So again, make sure you follow the link. Should you need any help with these or any other services that we can help you with, never forget we're always here to answer your questions and help you with any services. Don't forget, we're going to be coming out really soon with our agenda for our conference. These and many other great topics are always addressed by NAMAS. Thanks, and thanks for tuning in today. Have a great day.